Hey everyone, guess what time it is? It's body boot camp time. We're going to try and do this speed round since it's over your lunch hour. I'm Dr. Melanie Palm, if you haven't met me, and we're going to display a lot of the devices and then talk about some of the specials we're doing with this virtual body boot camp. Thank you for everyone tuning in, but also thank you. I know packages have been very popular already. So let's give you some information and give you sort of a sneak peek in terms of what some of these procedures actually look like. So we have two of these Exion/Emphase devices, and we will go over both of these technologies. Exion is a newer technology from BTL, radio frequency, and it has two different tips. So what we're demonstrating right now is radio frequency through microneedling, and there might be a pop quiz that you can get one of our little gift baskets from. So if you can remember Exion from BTL, new technology, and it combines two technologies. It's microneedling and radio frequency with one of the hand tips. And so this is Julia, one of our fabulous PAs, Julia Jowett, and she is demonstrating on Danny something called microneedling. And I actually had this done maybe 2 weeks ago on a weeknight after hours, was able to come back to work the next day, and definitely didn't look like a science project. I was like slightly pink, but not bad at all. And with topical numbing, we're really big on patient comfort, easy procedure, and the microneedling, we're really targeting the dermis, so this helps with the glow up, and I also think it helps when we're treating face, neck, and chest with a skin tightening effect. It's done as a series of treatments. We have it packaged as such. The other platform that's on this Exion is called Exion Clear. And typically we don't think of radio frequency as going after pigment or going after redness, but that different tip, we can actually ablate, microablate, so treat the very top layer of the skin and target pigment. And it's actually been shown in before and afters to improve redness. So that's the other sort of package that we have along with the Exion. So we've been packaging Exion a lot with liposuction, which is our other skin lifting technology that's ultrasound based. But I think the Exion microneedling and radio frequency at the depth that we're treating is just really treating the dermis, making it juicier, helping with skin radiance, very helpful. And then the last thing, we're obviously not demonstrating on camera, but another device that we have from BTL is called MFEM. And it is radio frequency monopolar, so you have a little grounding pad on usually your trunk somewhere, usually your flank. And we treat intravaginally and exteriorly to help with circulation and to help with tissues in sort of the genital area to improve female health. So if you have questions about that, we would love to talk to you about it. We offer complimentary consultations for that right now, just since we've kind of been reintroducing that into the practice. And then Julia, I don't know if you have any parting words before we leave the room. We're going to come back to you.
Yes, I'll talk a little bit about therapy as well, but as you can see, she's so comfortable, and that's one of the things I love about this device. The deep RF microneedling is very tolerable with just topical numbing cream.
All right. Well, thank you guys. We'll be back here in a second. We're going to go down the hallway to one of our other rooms, and we are going to chat with Ricky, who's one of our non-invasive body contouring experts, about two of our technologies. Hello. Ricky, say hi to everybody.
Happy Thursday.
And we've got the lovely Isabel getting,
she's getting her.
You had insult before?
No,
this is new.
Yeah.
How are you doing, girlfriend?
It's good.
You're going to get killer abs for the skiing season, aren't you?
That's what we said.
Oh my gosh. So, I have been skiing a little bit, and I need to get back on this because I noticed that when I do this, and we can even treat the quads, we can treat the abdomen, we can treat the buttocks, we can treat the arms.
Calves.
Yeah, it really, so this is, again, BTL technology, uses radio frequency to deliver a little gentle heat to help with fat reduction if you're trying to do that, or with skin tightening. And then also uses high-FEM technology, which is high intensity sort of electromagnetic energy, focused electromagnetic energy, and that helps with causing supramaximal contraction of the muscles. So we're able to get contraction of the rectus abdominis muscles right now. So those your 6-pack and 8-pack. Georgia agrees.
She wants to do it.
And this goes beyond what you're able to do with the best trainer in the best gym.
Absolutely.
So I think this is a nice compliment. This is literally what you wonder what those actors in films that are the action films, you wonder what the Victoria's Secret models are doing to get those fabulous abs. They're using this.
Right.
And some of them haven't been quiet about it. So I think this is really great, not only for the aesthetic benefits, but the functional benefits. We've had patients treat their abs and their buttocks, and things like low back pain or limitations in activity have improved. There have been studies that have shown treating core to floor, so treating the abs, treating the buttock, and then there's something called insula, so treating the pelvic floor. We can improve sit to stand time, we can improve a lot of functionality because we experience something called sarcopenia or muscle loss over time. So that's kind of a premise of Sculpt. Isabel, how is it?
It's good.
Yeah.
Yeah, it's very
pretty easy.
comfortable. Yeah.
It's not, I kind of like it. Once you get used to the sensation, I actually like try and tense my abdominal muscles, and I think you get a little bit more out of it. One of my friends said, pretend like you're Arnold Schwarzenegger, you know, and back in his day.
Every contraction.
So contract. While it's contracted, you get used to kind of the pull straight. So done as a series of treatments. We're doing a special with Sculpt. You get one free if you buy the usual package of 4. And then maybe you want to talk about CoolSculpting as well.
Absolutely.
So I'll let Ricky take over.
Yeah. So obviously this is our cool sculpting machine. If none of you have ever seen it, I know a lot of our patients have and love this treatment. This is another body contouring treatment. So this basically uses a completely different technology and method to destroy fat cells. It uses freezing. So basically you freeze those fat cells, the cells go through something called cryolipolysis, and they're released naturally through your metabolic system over the next 12 weeks. So what I love about this treatment in general is it's super customizable. We have multiple different applicators, and we can treat multiple different areas. I mean, all the way from your submental here, all the way down to your knees. And that's the beautiful thing about it. We do suggest usually to do 2 sessions of them, so that kind of bumps your percentage up. Usually we see about a 20 to 30% reduction in the area that's been treated of fat. If you do that second session, it can kind of bump it up to like a 40%. So again, that'll be upon consultation, you know, with Christy or myself. And yeah, like I said, you can treat your submental, you can treat your raw fat, you can treat your banana roll. I mean, honestly, any area that bothers you, it can be treated with this, which is nice. It is best for like pinchable fat, so like that targeted, like if that's in your arms, your abdominal area, so like subcutaneous tissue that you can actually pinch and grab. It's best for that. We're not using any radio frequency, so we're not targeting the muscles. Sometimes these treatments are done in combination. You know, you start with doing the cool sculpting, and then we kind of wait the 3 months, and then you can do a series of Sculpt as well. But yeah, this treatment, 15 years?
Yeah,
I mean, it's been
over
around.
that, and literally hundreds of published clinical data trials and papers on it. I've tried and true, kind of the gold standard for non-surgical fat removal.
Yeah.
So we use that for debulking, and then we use this for really toning up the muscle underneath, and a little bit of finessing in terms of fat removal. Georgia has made an appearance. I'm sure you heard her in the background, and it's because she wanted Mom to make sure that she's talking about the raffle prizes. So this is one of our raffle prizes. If you can do a couple things, either your favorite procedure that you've had in the office or looking forward to doing, or if you can tell us with the Exion, what are the 2 technologies that we use on that platform to help with skin rejuvenation. Put it in one of your comments, and we're going to raffle these off. So Revision, there's like 5 products in here, including their vitamin C. It's got their new body contouring product that we love for crepey skin. It's got Revox, which helps with sort of relaxation. Their gentle foaming cleanser is there, so it's a really nice package. And then with all of these packages, we are giving away skincare. So since we're talking about body contouring, we love Elastin Body Transform, which has been shown to help with something called autophagy, which is basically our body eating up cells that are not doing well. So if we've got unstable fat cells, it helps eliminate them. It doesn't eliminate, healthy fat that we want to keep, but if we're trying to do something like fat reduction in the area of treatment, it's been shown to enhance outcomes by up to like 30% depending on the person. So we use that as standard of care. It also builds collagen, helps with elastin stabilization. So we're going to say goodbye to you, Jackie. Thank you, Isabel. During her first Sculpt
I know
treatment.
she's doing great.
Yeah, woohoo!
Definitely.
Abs of steel. We're going to leave that.
She's all ready for summer.
Okay, we're going to come back to another room, and we're going to meet Christy and talk about a very popular procedure that we actually finishing up a clinical trial on. in-face. So we have had this technology, gosh, almost 2.5 years now. The first indications were on the forehead and the mid-face for lifting and toning the muscles. And then we had another new application in the past year that treated the submentum, or the chin area, the double chin area. And most recently, we just completed a clinical trial for the under eyes, which you can actually see treated now. So maybe if you want to explain how that works, because we are now able to talk about it. We don't have the applicators yet. We can start ordering them sometime in early April. So I think by mid-April we've got patients that want to be treated. We've got a line of them. But let's explain the technology. Maybe show if we can kind of zero in so people can see the treatment.
Cute little muscle twitch under here. So what M-Face does is it is a device that it's sort of a 2-in-1 device. It's going to tone the muscles in the face while delivering radio frequency at the same time to help with collagen, elastin, and hyaluronic acid production. So around the eyes, our new application, she's getting radio frequency through this whole area to help with fine lines and wrinkles. And not that Natalie has any. It helps. We also see that it helps with discoloration under the eyes, with any hyperpigmentation, or when the blood vessels kind of show through that skin, causes a little redness. So what it does is it tones that little tiny muscle, the orbicularis oculi, that's right under here. So it's only doing the muscle toning here. So it's not going to create crow's feet over here. And by strengthening that muscle, it ends up sort of helping with puffiness by pushing that little fat pad that people get under here back where it belongs, and also covering a little bit of the vascularity under there, so by thickening that muscle, so they get some really nice improvement in any discoloration in that area.
So one thing we're doing if you get an M-Face package is we are providing HA Immerse serum, and if you're doing the M-Face eyes, we have an eye cream that we're partnering with it, which I think is great. We were a part of the clinical studies. It's 3 clinical sites. There's 30 patients in it, and in a month after 4 treatments, which is the prescribed sort of dosing for an average patient, we saw a 62% improvement in discoloration of under eye circles, because you're really setting in this muscle here. So it's holding in your infraorbital fat pad, which is your fat pad here, tightening things up. We see really nice improvements in the crepiness. The crow's feet on their own without toxin treatment was improved about 26%. And then the volume, if people have fat herniation, which is what we were looking for in the study, it reduced that volume on average by about 1.4 milliliters, which is like 1.5 syringes. Like that's not an area we put filler, but if you think about it in that terms, it's actually quite dramatic. So we're pairing that with lovely skincare. Here's another raffle item. So one thing that you could put in the comments, Christy talked about 2 technologies. The muscle toning technology is called HIFES, and then the heating technology is radio frequency. So at the end of this, if you can enter the 2 technologies for M-Face, that allows it to work. But we're really excited. I've done 3 of my 4 treatments. I can't wait to do the 4th. I'm going to wait until we have pads because we want patients to be treated first. And then one of our raffle prizes, we talked about revision. We've got elastin. We have Art of Skin and D. Also lovely. All of them have like 3 to 5, 6 products in them, so they're really great raffle prizes. And then finally, before we leave this room, want to mention the VI peel, which we can use for pigmentation and acne and overall rejuvenation. So maybe just quickly explain the 2 that we have.
So we carry the Precision Plus and the Advanced VI peel. The difference between the 2, the Precision Plus actually has a little bit of hydroquinone in it, which is what we use to treat hyperpigmentation, meaning melasma or sun damage. It helps to suppress the melanin in the skin. So we normally recommend a series of 3 treatments. The Advanced here is more for collagen rejuvenation. It helps with fine lines, wrinkles. It still will help with some discoloration if you just have that scattered pigment. Helps with acne scarring and post-inflammatory hyperpigmentation from acne spots. It's a fabulous peel. You can do it any time of year. There is a tiny bit of downtime around days 3 through 5. You're pretty peely.
And you just want to avoid the sun, avoid some exercise during that time, but very easy to go through. Not a painful peel at all, and it is a medium depth peel, so it really gets in there and does its job.
All right, perfect. And despite it being a medium depth peel, if you do a typical TCA peel that's 25 to 35%, it is like your face is on fire.
Yeah.
And this does not hurt, which I think is really impressive with this. And, chemical peels are always meant to be done as a series of treatments. So I think we package it as a series of 3, which is pretty typical. And you want to space it out about a month apart. But I've done it. I haven't taken time off of work, obviously, and you're just real peely, like day 3 through 5. But you're not like a science project.
Yeah, exactly.
You're not red and irritated. So thank you guys so much, Naomi, our lovely model, and Christy, our amazing body contouring expert. We're gonna go back to our original room, and we're gonna talk about the last couple of things. So we just wanted to touch upon our other major sort of skin lifting technology, which is very tried and true, and is Ultherapy. And this I love because it was the first approved technology that in real time we get visualization of the tissue, but also can cause skin tightening with a very novel technology, ultrasound. So we can bypass the skin surface, hit the dermis, and then the SMAS, the connective tissue that encases our muscles of facial expression, and allow for lifting technology to take place over the next 3 to 6 months. So you can see we're treating the submental area, or the area of the double chin. It's really common to do full face treatment or full face treatment with neck, and that encompasses treating the brow area for lift, the lower cheek region for lifting the jawline, treating underneath the chin area for lift, and then when we do full neck, we're also treating obviously the full neck region. So, I've had this procedure done about 4 times, and we've got lots of ways we can make this comfortable. So I've just always been at the end of the day, and one of the PAs does it, and I just muscle through with some Tylenol, Advil, and some topical and some numbing dots. But we also have options for making it super comfortable and you feeling like you're having a nice little glass of wine while you have it. And obviously that includes a driver to drop you off and pick you up. But any sort of words of wisdom? I know you love this technology, Julia.
I do, and I think one thing I want to talk about is that we have different tightening devices and how to know which device might be right for you. And of course, we talk about that in a consultation. But one thing that I find is that Ultherapy is really good at more of that heavy-duty lifting because it is really targeting at that SMAS layer. So if you have, heavy jowls, heaviness in your submentum, that's when I tend to go for this first. If you have more, diffuse kind of like crepiness, you want to cover, little tiny wrinkles, you want to get some of that, kind of shrink wrapping effect to the skin, then I'll go for the radiofrequency microneedling. In some cases, I'll say start with an Ultherapy, get that heavy-duty, deeper lifting, and then do a series of microneedling with radiofrequency to get some of those details. So it really depends on the person and the anatomy. I know we also showcase the M-face, and that has a nice place as well for getting that muscle toning that we have not always had. But really, it's customized by the person.
Yeah, and that's why I think the cosmetic consultation is so important, and having a practitioner that has the knowledge and the education and the experience to actually personalize and create like a bespoke plan for you, which is exactly what you're speaking to. So if you do have questions, come in, we'll do a consultation, we can help you, if you're interested in one of the specialists, figure out what's sort of tailor-made for your needs. And then finally, we wanted to talk about some of the injectables. So here's one of our other raffle prizes to remind you, if you can put in the comments either what's the device your favorite, what are you really interested in doing. You could mention with the BTL microneedling, what are the 2 technologies that we use in that, or you could also list with M-face, what are the 2 different technologies that help with the muscle toning and the skin textural changes. But we are offering, since this is a body event, there are 2 injectables that we use quite a bit to help with skin quality and volume replacement. And that is 2 collagen stimulating agents, Sculptra and Radius. And so Sculptra is PLLA. We've had it approved since the early 2000s here in the US. We have been privileged to be a part of, 8 or 9 studies at this point. We're actually doing the FDA trial on the chest right now after completing a pilot trial. And we use this for collagen stimulation on the face, but we use it in a lot of areas of the body, such as the chest, the abdomen, the booty. We use it on thighs sometimes. But it is a very popular product because it improves skin quality, and then in larger doses helps with volumization. So if people want a little bit more roundness to their bottom, then we often will talk about Sculptra. Radius is lovely as well. I use this a lot, and so do Julia as well as Stephanie, our two PAs, in terms of improving quality and skin texture on the neck. So sometimes we'll do ultherapy to help with skin lifting, and then we'll go back with a little radius wash several times to help with skin quality and crepiness in this area. Radius is lovely when we have volume deficits. So if people have, you know, a small area they've had for a long time that's a divot in the bottom or on the backs of the thighs, we'll talk about that. I had a lovely patient, she's getting ready for a big event. She had liposuction and was left with an indention from the surgeon. So we replaced it with a little bit of a collagen stimulating product, and I saw her 6 weeks later, and she's thrilled because she's got a sleeveless dress and wanted to look really great for that. So just so you know, the specials with this, they're bundled together with Sculptra. It's buy 3, get 1 free. With Radius, it's buy 2, you get 1 free. And you know, we obviously don't mind if you're using that on the face rather than the body, but since we use this on the body, we're including it. They're both very popular, and I know we've had a lot of patients buying both of these packages. Finally, we've got the Art Skin raffle. We kind of went over that, and then we have a Neo Cutis package as well, which has the cutest mirror, or not a mirror, it's a little headband in there, as well as products that are amazing from their line of growth factors. So that kind of wraps things up. If you guys have questions, we are on lunch right now, but we will be back in about 30 minutes at 1 p.m. and we certainly can answer your questions. This is the first week of Body Boot Camp, so we'll be running through next week. And certainly that gives you time. If you have questions, we can get you in for a consultation and talk about sort of which package is best for you. Things with the body contouring are always complimentary. If you do want to talk about MFEM, for right now, we're allowing that to be complimentary as well. But Julia, Stephanie, and myself can help you with all your needs in terms of some of these other technologies that are just not the body-driven M-Sculpt and Cool Sculpting. So with that, we're going to conclude Body Boot Camp. Hope you guys all have a great weekend. Leave comments. We've got several raffle prizes, and we want to make sure that we've got great winners. So thanks, and have a great weekend.